After more than 30 years working with older adults, there's one moment I always pay close attention to, the moment in the morning when you first open your eyes. So many of my patients have told me things like, "Doctor, I feel dizzy when I wake up. Why is my blood pressure always higher in the morning? Sometimes I stand up and I just don't feel steady. My head feels foggy." What's interesting is this. Most of them don't have serious heart disease. They eat reasonably well. They take their medications, they go to regular checkups, and yet every single morning, there's that quiet worry. Is my body going to cooperate with me today? Here's the truth most people are never told. After age 60, your body does not like being woken up suddenly. After a long night of sleep, your circulation is slower, your blood vessels are relaxed, your heart rate is lower, your nervous system is in energy-saving mode. And then, in just a few seconds, you sit straight up. Your feet hit the floor, your body has to fight gravity, your heart has to push blood up to your brain, your blood pressure has to adjust immediately. In younger people, the body handles this pretty quickly. But after 60, that sudden transition is exactly what leads to morning dizziness, a spike in blood pressure right after waking, a heavy pounding heartbeat, and an unexpected risk of losing your balance or falling. My name is David Warren, and I'm a doctor who specializes in senior health. And if there's one thing I want you to remember from the very start of this video, it's this: age is not the problem. How you start your morning is. You don't need intense exercise, you don't need more medication, and you don't need to push yourself to be strong. What your body really needs is a gentle transition from rest into movement. In today's video, I'm going to share a simple system I've taught to many of my patients in real life. It doesn't take much time, it doesn't feel scary, and it's especially suitable for people in their 60s, 70s, even 80s. Just a few minutes each morning can help you reduce stress on your heart, stabilize your blood pressure earlier in the day, feel lighter and steadier when you step out of bed, and most importantly, you start your day feeling in control, not anxious. If you've ever thought, "I'm older now, of course, mornings are hard," I want you to stay with me until the end of this video. It may be that your body has simply never been taught how to wake up the right way. Part 1. Preparing your body before standing up. The foundation of morning heart protection. Before you stand up in the morning, there's something very important most people never think about. For many hours, your body has been lying flat. When you're lying down, gravity isn't pulling blood into your legs. Your heart works with less effort, your nervous system shifts into deep rest. That's great for sleep, but it also means your body hasn't practiced working against gravity for hours. Problems happen when you sit up too fast, stand up immediately. In that moment, your heart has to increase its pumping force, push blood back up to your brain, adjust blood pressure in a very short time. After age 60, that adjustment takes longer, not because you're weak, but because your automatic regulation systems simply need more time. Without preparation, you may feel dizzy, a strong heartbeat, unsteady, or simply not ready yet. When you give your body just a few minutes to prepare before standing, the difference is clear. Your first step feels more stable. Your mind feels clearer. Less lightheadedness when leaving the bed. Your heart isn't forced to work suddenly. Many of my patients have said, "Doctor, I never imagined that just changing how I sit up could make mornings feel this much easier." And they're right. Mornings don't need force. They need rhythm. Here's what I recommend. When you wake up, don't rush out of bed. Stay still for 20-30 seconds. Sit up slowly, keeping your feet on the bed. Take 2-3 slow breaths. Only place your feet on the floor when your head feels clear. No exercise is required. Just give your body time to transition. That's not laziness. That's respecting the natural physiology of an aging body. I often tell my patients this: your body in the morning is like a friend who just woke up. Pull them up too fast and they'll stumble. Give them a few minutes and they'll walk with you steadily. Never underestimate those first minutes of the day. They determine how your heart, brain, and nervous system function for hours afterward. Part 2. Waking up peripheral circulation. The key to lighter legs and a clearer mind. There's one reality very few older adults ever have explained to them. When you sleep, blood and fluids naturally settle in the lower body. For hours at a time, the calf muscles barely contract. Small blood vessels aren't stimulated. Peripheral circulation slows down. So when you wake up, you may notice heavy legs, cold feet, numbness or stiffness, slower blood flow to the brain in the first minutes. This isn't a disease, it's a normal result of prolonged stillness. To improve it, you don't need intense exercise. You simply need to wake circulation from the outside and guide it back toward the center. When peripheral circulation is gently activated before standing, people often feel lighter legs from the very first step, less coldness in the feet, better balance around the house, faster mental clarity. Many of my patients realize something important. When my legs are ready, my mind follows. That connection between the body and the brain is very real. While still lying in bed, try this. Stretch your legs comfortably, gently flex and point your ankles. Pull your toes toward you, then relax. Move slowly and steadily, about 20-30 times. No force, no speed, just rhythm and awareness. If your feet start to feel warmer, that's a good sign. Your circulation is waking up. I often tell my patients, don't ask your legs to work while they're still asleep. After 60, the body doesn't need pressure. It needs an invitation. Think of this as saying to your body, we're about to start the day, let's do it gently. Part 3. Stabilizing morning blood pressure through breathing. How to calm the nervous system directly. There's something many older adults are surprised to learn. Your morning blood pressure isn't controlled by your heart alone. It's strongly influenced by your nervous system. Right before and after you wake up, your body releases certain hormones to help you feel alert. In younger people, this process is usually smooth. But after age 60, that hormone surge can come with feelings of tension, a racing heart, or lightheadedness. At that moment, your heart isn't speeding up on its own. It's responding to signals from your nervous system. And here's the good news. You can change those signals with your breathing. Slow, deep breathing activates the parasympathetic nervous system, the part that helps relax blood vessels, slow the heart rate, stabilize blood pressure. When you use breathing correctly in the morning, many people notice a clear drop in feelings of nervousness or panic, less of that sudden blood pressure spike after waking, a clearer head, less mental fog, a calmer mood to start the day. Many of my patients have told me just a few minutes of breathing and my whole body feels calmer. Here's how to do it while lying or sitting in bed. Place one hand on your chest, one hand on your belly. Breathe in slowly through your nose. Feel your belly rise, breathe out gently through your mouth. Keep your lips softly closed and let the exhale last longer than the inhale. Do this for 4 to 6 breaths. You don't need to count perfectly. Just breathe slower than usual. If your shoulders drop and your heartbeat feels calmer, you're doing it right. I often remind my patients, sometimes the best way to help your heart work better isn't to make it beat harder, but to calm the nervous system around it. Breathing is the most direct bridge between your mind and your body, and morning is the perfect time to use that bridge. Part 4. Morning order matters more than intensity. The right sequence protects your heart. Many older adults ask me, Doctor, I stay active every day, so why do I still feel tired in the morning? The answer usually isn't how much you do, but the order in which you do it. The human body works in a chain of physiological responses. In the morning, that chain typically unfolds like this. The nervous system wakes up. Circulation gradually adapts to gravity. Muscles prepare to bear weight. The heart increases rate and pumping force. If you reverse that order, for example, standing up immediately after waking, walking quickly right away, bending or twisting before you're stable, your heart and blood vessels are forced to catch up reactively. After age 60, this creates unnecessary strain on the heart. When you respect the proper morning sequence, people often notice less pounding in the chest when standing, less fatigue in the first 1 to 2 hours of the day, more confidence moving around the house. Blood pressure stabilizes earlier without waiting until midday. One patient told me, "I used to feel like I was chasing my body every morning. Now my body moves with me." Here's a simple rule to remember. Lie, sit, prepare, stand, walk. Lie, let your body wake up. Sit, give your heart time to adapt. Prepare, gentle movement, slow breathing. Stand, only when your head feels clear. Walk short, slow steps for the first few minutes. No extra exercise needed. Just change the order. I often tell my older patients, your heart isn't weak, it just needs a little warning. Treat your body in the morning like a friend who just woke up. Don't rush it, don't force it. You'll be surprised how much your whole day can change just by changing the sequence. Part 5. Turning mornings into a safe zone for your heart. Small habits, long-term results. The human body learns quickly from what it experiences every day. This is especially true for heart rate, blood pressure. The autonomic nervous system, if you wake up every morning rushed, stressed, intense, your body learns that mornings are a time to overreact. But if your mornings are calm, predictable, and well-paced, your nervous system learns, there's no danger here. I don't need to overreact. Over time, this helps. Reduce morning blood pressure swings. Stabilize your resting heart rate. Lower automatic stress responses. This isn't a one-day effect. It's a gradual, accumulated physiological adjustment. People who create a heart-safe morning routine often notice less anxiety right after waking, more stable morning blood pressure week after week, a stronger sense of control over their body, less fear of mornings, especially after past dizziness or falls. Many patients have told me, "Doctor, I'm not afraid of mornings anymore." And that's a huge improvement in quality of life. I usually suggest 3 simple habits. Keep your mornings consistent. Wake up around the same time. Avoid stressful news first thing. Check in with your body before doing anything else. A few minutes of breathing. Gentle movement. Stand only when you feel ready. Don't check blood pressure while anxious. Wait until your body settles. Avoid the loop of worry, tension, higher readings. I always emphasize this to my patients. Your heart is very loyal. It responds to how you treat it every single day. You don't need to change your whole life. Just give your mornings a safe, predictable pattern. Over time, your heart will trust you. And when your heart trusts you, your body will cooperate. Closing, not to be younger, but to be safer, steadier, and more confident each day. If you think back over everything we've talked about, one thing becomes very clear. No intense workouts, no new medications, nothing beyond the abilities of someone over 60. We're simply helping your body wake up the way it's meant to. Morning isn't the time to prove you're still strong. Morning is the time to let your heart settle. Clear your mind. Prepare your body to start the day without fear. Just remember 3 things. Don't rush when you first wake up. Give your circulation and nervous system a few minutes to start. Respect the natural rhythm of an aging body. Many of my patients once believed, "I'm older now. Mornings are supposed to be hard." But after making these small changes, they realized it wasn't age making me tired. It was how harsh I was with my mornings. I'm David Warren, and if there's one final message I want to leave you with today, it's this. You don't need to fight aging. You just need to work with your body. When you start your day safely and with intention, your heart works more gently, your blood pressure stabilizes earlier, you feel more confident with every step, and that fear of mornings slowly fades away. If you found this video helpful, please subscribe for more calm, science-based guidance designed for adults in their 50s, 60s, and beyond. No pressure, no judgment, just support for long-term health. And finally, an important reminder. This video is for educational purposes only and does not replace personal medical advice. If you have a medical condition or are under treatment, please consult your healthcare provider before applying these tips. Thank you for taking time today to care for your health. Just start your mornings a little more gently, and you may be surprised how much your whole day improves.